Hey, good afternoon, Team IED. It's Brigadier General Dan Tulley, Command Chief Master Sergeant Kenny Bruce here with your daily update on COVID-19. Got a lot of questions from folks coming in. Thanks. Keep those questions coming in, and appreciate the focus on solutions instead of just observations. That is really paying off for us.
All right.
All right, Chief, what's the first question today?
All right, so you ready? Where can Guard or Reservists go to get more information?
Great question. The Air Force Reserve Commander, Lieutenant General Scobie, is going to host a town hall tomorrow, Friday. That'll be at noon Eastern Time. It'll be 1900 local here at IUD. It should be able to answer a lot of questions that folks have.
All right. Next question from Master Sergeant Joseph Polzer and Technical Sergeant Michael Prokop. They both asked about what's going on with the Wi-Fi.
You know, we understand it's important to everybody to be able to communicate, especially with loved ones back home. I was on a video chat with my mom and dad just a couple days ago. So 3 things are going on with regards to Wi-Fi. Our goal is to get free, fast Wi-Fi for everybody here on IUD. Our most promising effort, negotiating with the local Qatari government. They're trying to help us out and provide this, but there's some negotiations with different contractors who provide that service. That's still going on. I can't give you a definite date. It looks close, but I'd be lying if I told you I had a definite date. Things around here move a little bit differently than they do back home, but we'll keep you posted on that. Second part of this, second line of effort, is getting new equipment. So how fast your internet access is has to do with the pipe coming in, the bandwidth, and it also has to do with the latency. Turns out our equipment on IUD is at least 10 years old. If we can update that equipment 70% faster right off the bat, so we're working on that. The third line of effort is 5G service. So it sounds like Ooredoo, the local phone company, has gone from 3 towers to 12 towers just in the past 9 months. They're not 5G yet, but they're 5G capable. That capability should be turned on sometime over the next 12 months. The beauty of that is that will make all Wi-Fi obsolete. It will be so fast, all you need is a 5G phone or device and you'll be screaming.
Yeah.
Correct.
All right, so the next question is about morale. Comes from Master Sergeant Stephanie Elliott, and Sergeant Brian Porter and Nicholas Wire asked about it as well. But how are we keeping our airmen positive and engaged when everything they mostly care about or enjoy is being limited or taken away?
You know, that's a great question, Chief. And from what Chief and I understand, talking to everybody out there at the DFACs or at the gym or just out there running around the base, that doesn't reflect the attitude of most of our airmen. But most of our airmen are focused on the mission. And mission accomplishment seems to be what drives most of you guys. It's why you raised your right hand. That's why you deployed here to IUD. So thanks for all you're doing with regards to that. But if you have any concerns, or if you're down in the dumps or feeling low, we do want you to get help.
Yes, we have helping agency teams. Lean on each other. Get out and talk to each other, as long as it's in groups of 9 or less. That's awesome. But be creative. I think there's a lot of different ways you can get after the morale problem, whether it's a DJ dance party. I've heard some other suggestions, spades, dominoes. You know, that's 9 or less. Just be creative. Think through some of those processes.
That's right. Service before self is what it's all about, and it can be really tough. COVID-19 is an enemy none of us expected to fight.
Yep. All right. This is from Master Sergeant George Smith. He asked the question of, if we haven't had a confirmed COVID case, at what point does closing more activities or services without any positive cases among a population of mostly isolated personnel do more harm and fuel more fear than it is intended to prevent?
Well, that's a great question. I'd ask you first, hey, bring us some solutions. If you're seeing what we're doing and it doesn't work, you know, we're trying to follow the AFCENT, CDC, Secretary of Defense, and CENTCOM guidance that's out there. But if you guys have a better idea or something that works better, please bring us specifics. Here's exactly what we think you should do or why. But I'll tell you this much, the guidance that is in place and all of our efforts to protect the force, prevent the spread, and ensure mission accomplishment, they're focused on getting that mission done. It's what we're focused on. We're going to keep going after it.
That's right. Master Sergeant Sullivan from the 379th EMDSS asked, what criteria will we need to reach in order for things to reopen for our services and facilities?
That is a really good question, and every day when I read the news, lots of experts around the world, people a lot smarter than I am, are trying to figure out the answer to that question. So what I think it's going to take is much better data. We're still trying to prevent the spread, right? So that our hospital systems and our medical care don't get overwhelmed, while we here in the military are also trying to continue with the mission as much as we can. So the data that is emerging as we get more testing results and we learn more about the virus will let us say, okay, we can now accept the risk. You know, how do we make sure that the risk to you guys as we protect the force is at an acceptable level before we relax the restrictions?
Nice. All right, this is Technical Sergeant Trent D. Morris from the 379th EMXS. He asks, how long does it take to run its course? Beat it. I have to redeploy, build a car, and proceed to NCOA.
I wish I had the hobbies and the time that you've got, but I do not. Instead, the best answer I can give you is I've read, and this is unofficial, but anywhere from a few weeks to 27 days is about how long it takes to fully run its course, but I don't have factual data on that. So like in the last question, we're trying to get those facts so we can give you these answers, but I heard Chuck Norris got over in about 2 minutes.
Yeah, he did. And then make sure you check the AFPC MyPurse page to get the latest when it comes to PME classes and all those different things, because there's been some drastic changes backstage side. Okay, next question comes from Staff Sergeant Jennifer Wynn from HNCC. She says that the Secretary of Defense ordered to stop movement. Why are transient and new deployers coming to IUD, especially when we're worried about COVID-19?
That is another great question. So the important thing here is to remember the focus on ensure mission accomplishment, right? There are going to be some exceptions to the guidance that's out there, and that includes the stop movement. We are having some folks continue to rotate in, and some folks continue to rotate home, even though there's a stop movement in place, and that is all focused on mission accomplishment.
All right. This is the last question. It's from Justin LeBurge from the KAOC. He asks, being in this environment when dealing with an outbreak like COVID is a major challenge, and people seem to be trying to do the right thing. However, where is risk being accepted? Risk to mission or risk to forces? The visible efforts across the installation appear to not have a clear goal with where to accept risk.
Justin, that is great feedback, exactly the kind of feedback that we need. So from your perspective, you don't see how our efforts align with our priorities. Protect the forest, prevent the spread, and ensure mission accomplishment. But I can assure you every measure that we've taken does directly align with that in some way. Some are more important than others, obviously. I'll give you the example of the dining facilities. Those are challenges because we have to put out 15,000 meals a day to feed this huge population. We only have so many dining facilities, so that's tough. But if you look at the Burger King wasn't feeding very many people, but at the same time we had to bring the contractors on base, we had to get all their supplies and the food on base, and so the juice isn't worth the squeeze to keep that operation going. But for each of the measures we put in place, we've got a really specific reason. Tell us exactly what the question is about which measure, and we'll give you that reason.
Yeah, no doubt. And I would say if you see anything that you can handle at your level, hey, take care of it. So whether that's bleach, wiping the tables, or whatever it may be, go ask someone for supplies. You can take care of that. If you see folks not social distancing, like ourselves right now, but that's okay because we're getting this important message out, stop them. But be professional about it.
That's right. If we had a nickel for everybody who's given us a great observation about people in lines, or about people not social distancing, or people not wiping down tables or doorknobs or whatever it is, we'd be rich men. But what we need you guys to do is take personal responsibility for all of that stuff. It all starts with personal responsibility and with you guys. Thanks for everything that you guys are doing.